Hello.
Washing my hands. Hi, my name is Carla. I'm one of the nurses in the office today, and today I'm just going to do an examination of your eyes, your ears, your nose, and your mouth before the doctor comes in to see you. It'll probably take about 10 or 15 minutes. Is that okay? Great. Thank you. And can you tell me your name?
Carmen Anderson.
Thank you, Miss Anderson, and your date of birth.
12/24/80.
Thank you. And can you tell me what day it is
Sunday.
and what year it is?
2020.
Okay, so we have 39-year-old Carmen Anderson, who is alert and oriented times 4. And Ms. Anderson, do you have a sore throat today?
No, ma'am.
And have you had your tonsils removed?
No.
Okay, and do you see near or far? Or do you have problems seeing near or far?
I'm nearsighted.
Okay, so today we conducted a visual acuity test on Ms. Anderson using the Snellen chart. We had Ms. Anderson stand 20 feet away from the chart, covering one eye at a time with her glasses, and she was able to read 20/40 and 20/45. This means that Ms. Anderson is able to see at 20 feet away what a person sees at 40 and 45 feet away. So everything went well with that, and we're going to go ahead and continue her eye examination. Ms. Anderson, if it's okay with you, if you could go ahead and remove your glasses, and I'm going to grab some gloves. So the first thing we're going to check, Ms. Anderson, is your conjunctiva and your sclera of your eye. If you can just look up for me, I'm going to pull down. So her conjunctiva is nice and pink and clear. Her sclera is nice and white and clear. Okay, that looks good. We see that Ms. Anderson's eyebrows and her eyelids are symmetrical to her face. No signs of deformalities there. And I'm going to grab my pen light, and I'm going to look inside your eye, and I'm just going to check your cornea and your iris and make sure everything's okay. If you can open up for me. Okay, on the eye. Okay, so the cornea is clear and the iris is the appropriate color. Everything looks good there. So the next thing are her eyes. We're going to check her six directions cardinal of glaze. And I just need you to go ahead and follow this pen light for me. Okay, great. So we just conducted the 6 cardinal directions of gaze using the pen light with Ms. Anderson, and we checked for nystagmus, strabismus, and pertussive. Everything was normal, no signs of deformalities there. And so the next thing we're going to do is check her pupils. So Ms. Anderson, I'm going to put this pen in front of you, and I just need you to follow it. Okay, great. And so Ms. Anderson, we just checked the perla of Ms. Anderson. Her pupils are equal and round and reactive to light and accommodation. And I'm just going to check your sinuses. Any pain with that? Any tenderness? Okay, and I'm going to turn the light off real quick. And if you can open your mouth for me. Okay, you can go ahead and put your glasses on. So we just checked Ms. Anderson's sinuses. Everything looks nice and clear. No signs of drainage or congestion going on there. The next thing we're going to do is check her ears. Tell me if you feel any pain or tenderness.
No.
Okay, great. And I'm just going to look at this ear. If you could look that way for me. Okay, other ear. Miss Anderson does have piercings in her ear, 2 on each side. There's no signs of infection or any lesions on her ears. So no signs of deformalities. Her ears are equal to her head and symmetrical. We used the otoscope earlier on Miss Anderson to check her tympanic membrane. Everything was normal. Her tympanic membrane was intact and translucent. We also conducted the Ryan and Weber test on Miss Anderson today, and she had a normal lateralization, and her air conduction was greater than her bone conduction. So it seems like everything with her hearing seems to be okay. The next thing we're going to do, Miss Anderson, is check your nose. So I'm just going to palpate on the nose, and you tell me if you feel any pain. Okay? I'm just going to look inside your nose, checking your nares, and there's no drainage. So everything looks good on her nose. And one thing we forgot to do with Miss Anderson with her hearing test is we're going to do the whispering test to make sure that Miss Anderson can hear. So I'm going to repeat something, and Miss Anderson, you just repeat it back, okay?
Mm-hmm. Big red.
Okay, great. And I'm going to go to the other side.
Blue sky.
Okay, great. And also, Miss Anderson, if you don't mind, if you can remove your glasses, I do want to check your lacrimal gland. I think I failed to check that. Open your eyes.
Mm-hmm.
Okay, great. So we just went back to check her lacrimal gland. Everything was normal, which is her tear duct. There's no drainage or any signs of infection. And we also conducted the whispering test on Miss Anderson to make sure she could hear what I said and repeat it. So now that we have her eyes fully done, her ears fully done, and her nose as well, we're going to go ahead and do the last examination, which is her mouth. So Miss Anderson, first I just want to check your teeth, if you could just tease.
Mm-hmm.
Okay, and I'm going to lift up and check your gums. Okay, everything is nice and pink. Teeth are clear and white. You can open your mouth up for me. Okay, I don't see any teeth missing. Okay, checking the buccal mucosa, that is her inside of her cheeks. Everything is nice and pink. You can stick your tongue out for me and open up real big and Great. So we just checked her uvula and everything was nice and pink, no signs of infection. And one more thing is I just need you to lift your tongue up. Okay. So everything looks great, Miss Anderson. How you feel?
Okay.
Great. So tell me, are you feeling any pain?
No, ma'am.
And is there anything else I can do for you today before the doctor comes in?
No.
And when I leave out, would you like for me to shut the door?
Yes.
Okay, well, it was a pleasure to meet you, and the doctor should be in with you shortly, okay?
Mm-hmm.
Thank you.
Thank you.